In this session, we are discussing health and well-being. To manage back pain in both the short term and longer term, it is important to see the bigger picture and to consider other contributing factors to our physical and mental well-being. Over the next few slides, we will explore some of those lifestyle factors that can have an impact on our well-being. Exercise. Sedentary and inactive lifestyles can increase the risk of developing back pain. Being active is so important to maintain both our physical and mental health, and it can also help to improve pain and improve mood. However, sometimes it's not always easy to get started. You might think negative thoughts about physical activity such as I won't enjoy this, or it's too hard, or you might try to do too much too soon. This is quite normal when we're trying to establish a new routine or habit. Normally, our advice to people who are trying to introduce more physical activity is to start small, setting yourself a target of maybe 10 minutes of physical activity or 10 minutes of walking per day, and to build up gradually. But the key advice is that doing something is better than doing nothing. Diet and weight management. Being overweight can place extra stress and strain on our joints, including our back. By maintaining a healthy diet and weight, this additional strain can be reduced, and which in the long term can hopefully improve pain levels. Sleep is an important and often underestimated component in managing long-term pain. Lack of sleep can lead to irritability, low mood, and can often even increase pain levels. Unhelpful habits that can contribute to poor sleep is caffeine consumption, electronic device use, and overeating before bed can have an impact on the quality of sleep. Drinking alcohol before bed may help you to sleep initially, but can reduce the overall quality of your sleep. Smoking and alcohol use. Smoking reduces blood flow and can slow down the body's healing times. A multitude of other health risk factors go hand in hand with smoking, such as increased risk of cancer, cardiovascular problems, and osteoporosis. Similarly, alcohol can reduce the body's immune system, meaning an increased susceptibility to infections and illnesses. Therefore, it's so important that we're addressing aspects of our lifestyle that may be negatively impacting our well-being, and we're looking at ways to address these. Another important lifestyle factor, is social support in family. It is important to utilize any social support in family that you have available, particularly when your motivation is low. When family members are aware of what you're working towards, they can provide extra incentive and motive for you to keep going, and can often help you to overcome hurdles that you come up against. Therefore, it's important sometimes to set your goal around your family or around an activity with a family member, which adds more meaning to that goal and can often help you adhere to that goal better. Stress and emotional health. Health problems, including back pain, can make us feel unhappy, scared, or angry. These strong feelings can be frightening in themselves, but they are very normal. Having a health problem can be distressing for all sorts of reasons. You may be in pain or have other unpleasant symptoms, and this can lead to worry, which can affect your life or make you feel that you've lost control a little bit over your body. This, in turn leads to distress, irritability, can affect your sleep, and can often lead to depression and anxiety. We know that pain it's not just a physical phenomenon or a physical sensation, as our body and our mind are so closely entwined, and that it's important whenever we're coping or dealing with pain that we are looking at both the physical and emotional aspect of pain. In the next slide, we'll explore this a little bit more when we talk about the mind and body link. Understanding how our mind and body are so closely interlinked and how each affects the other is important. Understanding how our emotions and thoughts have an impact on our well-being will provide a more insightful approach to managing both the physical and emotional sides to back pain. But what do we mean by the mind and body link, and how does it work? The mind-body link refers to the relationship between our thoughts, emotions, and our physical health. This means that our thoughts, feelings, beliefs can positively or negatively affect our biological functioning. In other words, our minds can affect how healthy our bodies are, and this also works in the opposite way as well, in that what we do with our physical body, so what we eat, how much we exercise, and even our posture can affect our mental health, again, both positively or negatively. Therefore, when we're looking at managing back pain, we're taking into account all of the factors that can have an impact on our pain and on our overall well-being. And this will take into account both the thoughts and emotional sides of pain and also the physical aspects of pain. In the next slide, we have an overview of the pillars of promoting good mental health, which in turn can have an impact on our physical health. The pillars of mental well-being. In the middle, we have an important pillar, which is to do with community and connection with others. Good relationships are important for your mental well-being. They can help you build a sense of belonging and self-worth and give you an opportunity to share positive experiences, therefore providing emotional support and allowing you to support others. Play and movement is another important pillar. This relates to physical activity, and we know that being active is not only great for your physical health and fitness, but it's also important for your mental health because it can help improve your self-esteem, it can help you to set goals and challenges, and by achieving them, causing chemical changes in your brain, which it can help to positively lift your mood. Lifelong learning, or learning a new skill. Research has shown that learning new skills can improve your mental well-being by boosting your self-confidence and again raising self-esteem. This can also sometimes help you to connect with others if you're learning a new skill in a group setting. Even if you feel like you do not have enough time or you may not need to learn new things, there are lots of ways to bring learning into your life, even if it's just by taking time out to read a book or a magazine. Another useful pillar in promoting good mental well-being is silent reflection or meditation, or what some others may use, which is called mindfulness. So paying more attention to the present moment can improve your mental well-being. This includes your thoughts and your feelings, your body and the world around you. Some people call this awareness to the present moment mindfulness, and this can be a useful tool to help you enjoy life more and maybe to understand yourself better. But getting into a habit of being more mindful can positively change the way you feel about life and how you approach different challenges. This slide illustrates the relationship between pain and the effect it can have on our behavior. For people living with long-term physical symptoms, mental illness is a common occurrence, particularly depression and anxiety. When we experience physical symptoms such as ongoing pain or discomfort, we will have an emotional response to that pain. So we will have, worrying thoughts about how we're going to cope. How can you plan for the future when you're not really sure what your health will look like? And this unhelpful worrying thoughts can lead to a change in behavior. So you may find that you avoid doing things, you might start staying indoors more, therefore becoming more isolated, or you may become angry at others because they don't really understand. And as a result of this, you will experience more ongoing physical symptoms because the more we stop doing things, the more deconditioned we become and the less able we are to do the things we used to do. This can become a perpetuating cycle, and it's often something that we want to help patients to break out of. Therefore, if you're finding that your pain is having this negative impact on you, on both your emotions and your behavior, that we're looking at ways of addressing that. This kind of touches on a tool that's often used to overcome unhelpful habits. It's called CBT, so it's cognitive behavioural therapy, and it can be a useful tool to identify kind of unhelpful thinking patterns that can have an impact on our behaviour. This slide illustrates the many tools that we can use to help you to take back control and to help reduce the emotional and physical side of pain. Some examples of these tools are breathing techniques, mindfulness, CBT, mindful movement, relaxation techniques, such as the body scan or muscle relaxation techniques, or even visualizations, walking, being out in nature, communication with people and connection through talking and humor, and maybe listening to music or being involved in dance can be ways of reducing stress. If any of these techniques are something that you like more information on, we can send you those links. Key points to take away from this session is that mental and physical health go hand in hand. One will affect the other. It is important to recognise if your mood is affecting your health, as there are lots of free services and resources available to help.